Here are 25 of the most commonly missed NCLEX-RN nursing questions. Can you get them right? These are the trickiest, most confused rules, and the numbers people most often misremember. Read each question, then answer before the 5-second timer runs out, and then see why. This is exactly how you practice on preppass.org. Let's begin. Question 1. A charge nurse is assigning tasks at the start of a shift. Which task is appropriate to delegate to unlicensed assistive personnel, UAP? A. Taking vital signs on a stable postoperative client. B. Performing the initial assessment of a newly admitted client. C. Adjusting the flow rate of a continuous 4 infusion. D. Teaching a client how to use an incentive spirometer. The correct answer is A. UAP may perform routine, standardized tasks such as vital signs on stable clients. Assessment, for titration, and client teaching require the judgment of a licensed nurse and cannot be delegated. Question 2. A nurse must see 4 clients. Which client should the nurse assess first? A. A client scheduled for discharge who needs teaching. B. A client reporting new onset shortness of breath and chest tightness. C. A client requesting pain medication for a headache. D. A client asking for help ambulating to the bathroom. The correct answer is B. Airway and breathing problems take priority. New shortness of breath with chest tightness may signal a life-threatening event and must be evaluated before less urgent needs. Question 3. Which nursing task is appropriate to delegate to a licensed practical/vocational nurse, LPN/LVN? A. Developing the initial plan of care. B. Providing discharge, teaching about a new diagnosis. C. Administering an oral medication to a stable client. D. Performing triage in the emergency department. The correct answer is C. LPNs/LVNs may administer many routine medications and reinforce teaching for stable clients. Care planning, initial teaching, and triage require the broader scope of the registered nurse. Question 4. The nurse is caring for 4 clients. Applying the ABC framework, which finding requires the most immediate action? A. Blood pressure of 148/88 mmHg. B. Temperature of 100.8 F, 38.2 C. C. Reports of mild incisional pain. D. Oxygen saturation of 86% on room air. The correct answer is D. An oxygen saturation of 86% reflects a breathing and oxygenation emergency and takes priority over an elevated blood pressure, a low-grade fever, or mild pain. Question 5. A nurse delegates client hygiene to a UAP. Which statement reflects the nurse's continued accountability? A. The nurse remains accountable for the overall client outcome and must follow up. B. The UAP is fully responsible for the outcome once the task is assigned. C. Accountability transfers to the provider who wrote the orders. D. No follow-up is required if the UAP is experienced. The correct answer is A. Delegation transfers the task, not the accountability. The RN retains responsibility for the outcome and must supervise and evaluate the delegated care. Question 6. Which situation is the highest priority for the nurse to report to the oncoming shift during handoff? A. A client whose dressing was changed 2 hours ago. B. A client with a newly inserted chest tube and unstable vital signs. C. A client who ate 100% of the evening meal. D. A client who ambulated in the hallway without difficulty. The correct answer is B. Handoff should emphasize the least stable, highest risk client. A new chest tube with unstable vital signs requires close monitoring and clear communication to ensure continuity of care. Question 7. A nurse observes a coworker preparing to administer a medication without checking the client's identification band. What is the nurse's best initial action? A. Report the coworker to the State Board of Nursing. B. Document the observation in the client's chart. C. Remind the coworker to verify 2 client identifiers before administration. D. Say nothing because no harm has occurred yet. The correct answer is C. The immediate priority is client safety. Reminding the coworker to verify 2 identifiers prevents a potential error. Formal reporting is reserved for repeated or unresolved unsafe practice. Question 8. The nurse is planning care for a group of clients. Which client is most appropriate to assign to a newly graduated RN? A. A client requiring titration of a vasoactive drip. B. A client actively receiving blood who is having a reaction. C. A client being emergently transferred to the ICU. D. A stable client needing routine postoperative care on day 2. The correct answer is D. A new graduate should be assigned stable, predictable clients. Complex, rapidly changing situations such as drip titration, transfusion reactions, and ICU transfers require experienced staff. Question 9. A client refuses a prescribed treatment. Which action by the nurse best respects client autonomy? A. Documenting the refusal and notifying the provider. B. Administering the treatment because the provider ordered it. C. Telling the client they will be discharged if they refuse. D. Waiting until a family member can convince the client. The correct answer is A. Competent clients have the right to refuse treatment. The nurse documents the informed refusal and notifies the provider, respecting autonomy while ensuring continuity of care. Question 10. Which of the following is the nurse's primary responsibility when a client signs a surgical consent form? A. Explaining the surgical risks and alternatives to the client. B. Verifying that the client's consent is voluntary and witnessing the signature. C. Deciding whether the client should proceed with surgery. D. Guaranteeing that the surgery will be successful. The correct answer is B. The provider is responsible for explaining risks, benefits, and alternatives. The nurse verifies that consent is voluntary and informed and witnesses the signature. Question 11. A nurse is prioritizing care using Maslow's hierarchy of needs. Which client need should be met first? A. A client's need for reassurance about surgery. B. A client's request to see the hospital chaplain. C. A client's difficulty maintaining a patent airway. D. A client's concern about the cost of care. The correct answer is C. Physiological needs such as a patent airway are the base of Maslow's hierarchy and take priority over safety, love and belonging, esteem, and self-actualization needs. Question 12. The nurse receives report on 4 clients. Which client should the nurse plan to reassess first after receiving report? A. A client with chronic stable heart failure awaiting discharge. B. A client with a healing surgical wound scheduled for a dressing change. C. A client requesting a snack before bedtime. D. A client who received 4 morphine 15 minutes ago and is now very drowsy. The correct answer is D. A client who is increasingly drowsy after 4 opioids may be developing respiratory depression and must be reassessed first to prevent harm. Question 13. Which task can the RN appropriately delegate to a UAP for a client on strict intake and output monitoring? A. Emptying the urinary drainage bag and recording the amount. B. Interpreting the significance of a low urine output. C. Deciding whether to notify the provider about the output. D. Adjusting the client's fluid restriction. The correct answer is A. Measuring and recording output is a routine task suitable for UAP. Interpreting values, clinical decision-making, and modifying the plan of care remain RN responsibilities. Question 14. A nurse is coordinating a client's discharge. Which action best demonstrates effective case management? A. Delaying discharge until every family question is answered in person. B. Arranging home health services and follow-up appointments before discharge. C. Providing only verbal instructions to save time. D. Leaving medication reconciliation to the community pharmacy. The correct answer is B. Effective case management coordinates resources across the continuum of care. Arranging home health and follow-up appointments promotes continuity and reduces readmission risk. Question 15. The nurse identifies a near-miss medication error that did not reach the client. What is the appropriate action? A. Ignore it because the client was not harmed. B. Record it in the client's medical record as an error. C. Complete an incident and occurrence report to support system improvement. D. Report it directly to the state licensing board. The correct answer is C. Near miss and error events are documented on an incident report for quality improvement. The report is not filed in the medical record, and licensing boards address serious professional issues only. Question 16. A nurse is supervising a UAP. Which observed action requires the nurse to intervene? A. The UAP raises the side rails after repositioning a client. B. The UAP offers a bedpan to a client on bed rest. C. The UAP reports a blood pressure to the nurse. D. The UAP applies a vest restraint without a current provider order. The correct answer is D. Restraints require a current provider order and specific criteria. Applying a restraint without an order is unsafe and unlawful, so the nurse must intervene immediately. Question 17. Which principle should guide the nurse when assigning client care during a staffing shortage? A. Match client acuity and complexity to staff competency. B. Assign the most clients to the least experienced staff. C. Give all unstable clients to a single nurse to concentrate care. D. Distribute clients randomly to save time. The correct answer is that safe assignment matches client acuity to the skill and scope of the staff member. Overloading unstable clients on one nurse or assigning complex clients to novices threatens safety. Question 18. A nurse witnesses a colleague documenting care that was not actually provided. Which ethical principle is most directly violated? A. Autonomy. B. Veracity. C. Beneficence. D. Justice. The correct answer is B. Veracity is the duty to tell the truth. Falsifying documentation violates veracity and is both an ethical breach and a legal risk. Question 19. A nurse is caring for a client on contact precautions for Clostridioides difficile. Which action is correct? A. Use alcohol-based hand rub after removing gloves. B. Wear an N95 respirator when entering the room. C. Wash hands with soap and water after client contact. D. Place the client in a negative pressure room. The correct answer is C. Difficile spores are not reliably killed by alcohol-based rubs, so hand hygiene with soap and water is required. Contact precautions, not airborne precautions, are indicated. Question 20. Which client requires airborne precautions? A client with a draining wound infection. B. A client with influenza. C. A client with scabies. D. A client with active pulmonary tuberculosis. The correct answer is D. Pulmonary tuberculosis is spread by airborne droplet nuclei and requires a negative pressure room and an N95 respirator. Wound infections and scabies need contact precautions, and influenza needs droplet precautions. Question 21. When donning personal protective equipment, PPE, which sequence is correct? A. Gown, mask, goggles, gloves. B. Gloves, gown, mask, goggles. C. Mask, gloves, gown, goggles. D. Goggles, gloves, gown, mask. The correct answer is A. The correct donning sequence is gown, then mask or respirator, then goggles or face shield, then gloves. The correct order reduces contamination risk to the wearer. Question 22. A nurse is assessing fall risk. Which client is at highest risk for falling? A. A 30-year-old ambulating independently. B. An 82-year-old taking a sedative who is confused. C. A 45-year-old on bed rest with side rails up. D. A 25-year-old awaiting discharge. The correct answer is B. Advanced age, a sedating medication, and confusion together create a high fall risk. Interventions such as frequent rounding and bed alarms should be prioritized for this client. Question 23. Which action best prevents catheter-associated urinary tract infection, CAUTI? A. Keeping the drainage bag above the level of the bladder. B. Routinely irrigating the catheter every shift. C. Removing the indwelling catheter as soon as it is no longer needed. D. Disconnecting the tubing to obtain urine samples. The correct answer is C. Early removal of an unnecessary catheter is the most effective way to prevent CAUTI. The bag should stay below the bladder, the system should remain closed, and routine irrigation is not recommended. Question 24. A nurse discovers a small fire in a client's trash can. Using the RACE protocol, what is the first action? A. Activate the fire alarm. B. Confine the fire by closing doors. C. Extinguish the fire with an extinguisher. D. Rescue any clients in immediate danger. The correct answer is D. RACE stands for rescue, alarm, confine, and extinguish. The first priority is to rescue anyone in immediate danger before activating the alarm and containing the fire. Question 25. A client is receiving oxygen at 4 liters per minute by nasal cannula. Which instruction promotes safety? A. Post no smoking signs and keep open flames away from the oxygen. B. Allow smoking if the client stays 6 feet from the tank. C. Use petroleum-based lubricant on the client's dry lips. D. Increase the flow rate whenever the client feels anxious. The correct answer is A. Oxygen supports combustion, so no smoking or open flames are permitted near it, and only water-based lubricants should be used. Flow rate changes require a provider order. Those are 25 of the most commonly missed NCLEX-RN questions. This is exactly how you practice on preppass.org. Read, guess before the timer, then see why. The full free question bank for your exam is there. Just search PrepPass plus your exam. Good luck on your exam.